my name is Katie Sleeper. Neil Browning and I are co-leads for record verification. Thank you so much for volunteering in this area. You are all greatly appreciated. We play a very important role in the overall success of the clinic. It is our job to be sure all of the treatment rendered during GMOM is entered into the computer, and we want to be sure our patients understand how to care for themselves after their treatment today. Every patient must be checked out with all procedure codes properly recorded in both the patient chart and on the computer. Additionally, each patient receiving a procedure at the GMOM clinic will be given oral and written post-operative care instructions that will include a follow-up phone number for the patient to call if needed. First, I'm going to talk about patient checkout. Patient will be escorted to the verification station. In hygiene, root canals, and fillings, these stations will be on the T-tables. In oral surgery, this will be in the post-operative care area. You will double check the patient treatment form to see that treatments rendered in that department were recorded and that the treating dentist signed the form. For example, if you are coming out of the root canal area, your area will be in the purple area on the form right here. The color coding on the form, as you see on the sheet, will match the department the treatment was rendered in. If the treatment and/or signature have not been recorded, you will find the treating doctor, hygienist, or assistant to get the proper documentation. We are expecting that the doctor or the hygienist will escort the patient to our area at the end of treatment, but that may not always happen. You will enter the treatment into the computer and ask the patient the follow-up questions listed on the software. Now, please watch a short demonstration on how to enter the treatment into the computer.
Hello and welcome to the Mission of Mercy Clinic Management Software Checkout Training video. This video will walk you through the steps required to check a patient out at the end of the clinic. First, let's take a bird's eye view of the clinic and see how your role fits into the big picture. Patients first enter the clinic at patient registration. At this point, all their information is recorded and they are assigned a chart number and given a patient chart. Next, they visit medical and dental triage, where doctors determine what care is best suited for the patient. Once that is determined, they pass through the routing desk, where they are either sent to radiology or directly to a treatment area. Lastly, once all the work has been performed, they then visit their treatment area's checkout station, where we track all the work that was performed. This video will focus on that checkout process. Checking out is the last stop for any patient visiting a Mission of Mercy clinic. At checkout, the patient is asked a few post-treatment questions and all of the procedures they received are entered into the computer system. So now, let's jump right in and see how easy it is to check out a patient. When you first log into the checkout computer, you'll need to pick which treatment area you are working in. It's usually really easy to tell what that is, but if you aren't sure, don't be afraid to ask one of the doctors or your team leader for help. Once you select your treatment area, you'll now have the option to search for a patient's chart number. Patients' chart numbers are located at the top right corner of their chart. Locate that first, and then enter it into the search box, and then click Search. Verify the name and number returned match the patient's chart, and then click Checkout. If this is the first time the patient has been checked out, you'll be presented with a few pre-checkout questions. However, if the patient has already been through the clinic, this step will be skipped. Most of the questions on this screen can be answered by the patient's chart. Those questions have a big blue help icon next to them which, when clicked, will show you where on the patient's chart that information can be found. For example, we can see tobacco use is indicated in towards the bottom of the front page. Let's say John Doe is a smoker, so we'll check off this box. The next two questions you'll have to ask the patient. If they decide they don't want to rate the clinic, then you don't have to check any of the options. Lastly, just check their chart for any pre-meds, record them in the system, and then click Next. If for some reason you realized you forgot or miskeyed any information, you can always click back and return to the previous screen. Now, let's take a look at how we enter procedures into the system. Tracking procedures is one of the most critical processes which occurs in the clinic. If information is not entered into the system completely and accurately, the clinic organizers can't reliably report on the success of the clinic. So take your time, be sure to thoroughly check the patient's chart, and don't be afraid to go ask the doctors exactly what procedures they did. Most patients will already have a few procedures listed on the right-hand side, if they had any x-rays taken or have been through dental triage, for example. Take a moment and confirm these procedures are listed on the patient's chart, and make sure you don't accidentally enter them twice. Once that's done, then you're ready to get started entering procedures. Let's look again at the patient's chart. On the back, there's a large section of procedures which the patient has received. To start, we'll enter this procedure for oral hygiene instruction. On the chart, we can see that that procedure code is 1330. Now if we look at the checkout on the computer screen, we can see that that procedure is listed as an option. Let's select that procedure and then click Add Procedure. Voila! Oral hygiene is now listed in John's procedures. If you realized that wasn't right, then just click the red minus sign next to the incorrect procedure and then click OK. Now some procedures require additional information to be entered before they can be added. For example, procedure 1351, sealant per tooth, requires a tooth number. When we click that procedure, a box for the tooth number appears. Let's take a look at John's chart again for that information. It looks like he had 2 sealants done, one on tooth 1 and another on tooth 2. Let's flip back and enter the procedure for tooth 1. I'll key 1 into the tooth number box and then click Add Procedure. Now we can see the sealant for tooth 1 on the right-hand side. I'll repeat the same process for the second sealant, clicking on the procedure first, entering the tooth number, and then clicking Add Procedure. Fairly painless. Repeat that process until all the procedures on the chart have been entered into the system. Now there might be a procedure listed on the patient's chart that doesn't appear in the computer system. Don't worry, all you have to do is click Other Procedure and then manually key the 3 or 4-digit procedure code from the chart into the procedure code box. If a tooth number or surface code is listed, enter those as well and then click Add Procedure. When you are all done entering the patient's procedures, click Next. We've now reached the final step. All we need to do is check off any prescriptions the patient was given. Like the pre-checkout step, there is a blue help icon which shows you where that information is listed on the patient's chart. Once all the prescriptions have been selected, click Finish, and then you're all done. Take the patient's chart and file it according to the instructions you were given by your team lead. If the patient is leaving the clinic and not returning, remove their wristband and have an escort take them outside. If at any time you run into problems and need help, just click the Need Help icon at the top left of the screen. This will let someone know that you're looking for help and they should be there momentarily. Once the person is done helping you, or you've solved the problem on your own, just click the black X at the top right next to Click here to cancel your request. That wraps up this brief introduction to the checkout process for Mission of Mercy clinics. You'll have more help during the day of the clinic, so if you're feeling a bit overwhelmed, don't worry, the system is really easy to use. Thanks so much for volunteering, and we'll see you at the clinic.
Now that you understand how to enter the treatment into the computer, let's talk about the second part of your job. You will be giving oral and written post-treatment care instructions specific to the department you are working in. For example, if you are in extractions, this is the sheet where you will go over bleeding, swelling, and discomfort and diet. You will want to point out the follow-up phone number on the post-op sheet, as well as the cutoff date for phone calls. When receiving the written post-op sheet with the patients, use your highlighter to highlight the most important points. These will be in bold print. It is very important to give thorough instructions so patients understand when it is necessary to call back for help. If they understand what to expect, it will minimize the number of callbacks. Instructions will be available in Spanish and English, and translators are available if needed. Oral surgery will have a patient post-op area where patients will be held until they are well clotted and are feeling well enough to leave. The patient will be given extra 2x2s as well as a baggie containing a bleach-soaked cotton roll. This bag will have a label instructing the patient to dispose of all bloody gauze into this bag before disposing in a trash receptacle. Oral surgery patients will receive their post-op oral and written instructions in this area before being escorted to the record verification station for oral surgery. Ask the patient if they have any questions, because now is the time to get them answered, because you have the doctor within reach. As patients are not allowed to walk unattended on the clinic floor, you will now need to use your red station card to signal for a patient ambassador to escort the patient to either the pharmacy, the lab, or the patient exit. Again, I want to thank you for volunteering. Remember, patients are our guests today. We want to help them however we can. Please treat everyone with kindness and patience. We want everyone to leave with a positive experience. We want you to enjoy your GMOM experience. Neil and I are here to help you in any way we can.